This year, we have continued to bring you stories around mental health, something that has been tested and challenged for all of us in one way or another during the pandemic.
This week, though, we want to focus the conversation around teens. In fact, studies show that 46% of parents say their teen has shown signs of new or worsening mental health since last March. So Priya Dykstra, Director of Outpatient Services at Forest View Hospital, joining us now to help equip parents with the tools needed to bring this conversation into their homes. Thanks so much for joining us this morning.
Thank you for having me.
So first, let's start a little bit. Obviously, teens have been impacted greatly from this pandemic, from isolation and all of the things that have been limited for them. But let's talk about, what you guys are seeing the most of and really what parents should be looking out for at this point.
Sure. So we've seen a significant impact with teens in the COVID-19 pandemic. A lot of these teens are facing grief, they're facing loss, increased anxiety, isolation, anxiety, depression, and then you see suicidal ideation as well. A lot of this is due to the shifting daily life that they're experiencing due to the pandemic, due to the shutdowns, due to school closings, and et cetera. Here at Forest View Hospital, we've seen a 44% increase in our adolescent referrals as compared to 2020. So that's really significant at this point. Some of the signs and symptoms that, adults can look for, guardians, parents, anything like that, is really significant and important in noticing what's going to change in the teen. We see a lot of change in sleeping patterns, too much sleep, too little sleep. A lot of it is around too much eating, too little eating, significant weight loss, significant weight gain. Some of that social isolation, being withdrawn, significant declines in academics, changing of friends that maybe aren't the best, risk-taking behaviors. A lot of those things are some of those warning signs and signs and symptoms that your teen may be struggling with something.
Yeah, and any advice for parents or guardians on how they can check in with that teen in their home and, without prying too much or making them feel uncomfortable, but kind of bringing up that topic and awareness?
Sure, yeah, that's a great question. So a lot of things that parents or guardians can do with the teens is communication. Keeping that line of communication open is so important, especially for the teenage population. A lot of times at this age, they want to shut down anyway, but keeping that open, making sure you're a safe person to talk to, getting really down to their level and making them understand that, hey, I'm experiencing this too, or this is what I experienced when I was a teenager. Really making sure they understand that they're not alone and they can come to you. I think that's really important. Another thing to know is mental illness is treatable. There's therapy, there's medication management, there's groups, there's a lot of things that can wrap around your adolescent and your teen to really help them. Another thing is what I had mentioned before, really looking at those signs and symptoms. It's really important to catch those early and address those as early as you can to make sure, hey, is there something going on? Or let's talk about this. Another really important thing is trying to keep that normalcy in place as much as you can. I know this is a very trying time for a lot of people, and we've been going through this for more than a year now. Especially for teens, when things change in their life significantly, such as schools closing down, going to a virtual platform, it really changes. So as much normalcy that you can keep in your household is really great. Keeping those family dinners, if that's what you had, cooking together, going for walks together, family game nights, anything like that is really important to keep that kind of stability for your teen.
And where would you direct parents or guardians if they say, what, maybe it's time to get some help? What would be a great place to start?
Sure. So here at Forest View Hospital is a great resource for teens, adolescents, children, adults, anybody. We have a 24-hour center here, referral center that is open 24 hours, 7 days a week. We have licensed clinicians available to help kind of guide and assess the patient into a certain level of care. We offer inpatient services, we offer partial hospitalization services, and we offer medication management services. When I talk about partial hospitalization services, it's like a day program. It's kind of like a school day. We offer a hybrid model, so you can come in person, you can stay home via Zoom, and it's a day program. Like I said, it's 9 a.m. to 2:30 p.m. We offer groups. They meet with a psychiatrist, a really strong interdisciplinary team that can work with them. So we have great resources here at our hospital.
Right. Well,